Here's what's new this morning. The demand for nurses across the U.S. is at an all-time high, but now Congress is in talks to put a cap on how much travel nurses get paid to fill those positions, and they want hospitals to focus on their local healthcare workers instead. Fox Carolina's Lindsey Gibbs is live in Greenville speaking with travel nurses from the upstate. Lindsey.
Good morning, Ashley. We're outside of Bon Secours this morning. Now, we're told by a spokesperson here that there are currently 70 travel nurses employed across their facilities, so it's really needed for their patient care. Now, we are told, we do want to clear up some confusion, that this cap for income is only for travel nurses, not for local nurses here in the upstate or across the United States. But this comes after 2 letters were sent from Congress and the American Hospital Association to urge the White House to consider putting a possible pay cap on travel nurse income, saying the prices hospitals are paying for their contracts are too high, adding that travel nurse agencies are taking advantage of hospitals' growing demand for nurses. Travel nurses typically work 13-week contracts wherever they're needed across the United States. Bon Secours tells us travel nurses are needed here in their emergency department, ICU, and within their medical and surgical levels of care. Now, I spoke to a travel nurse within the upstate that says the jobs comes with a lot of obstacles, which require higher pay, like finding short-term leases, moving and starting a new life every few months, which can be especially hard with the night shifts many of them work.
For me, it's kind of hard to sleep when I get home, just because you kind of want to wind down and leave that stress at the door, but it's really hard to when you're kind of dealing with it and knowing what you're going back to after you wake up. So in that perspective, it does really get difficult.
He also says that they shouldn't be undervalued for their work, but there should be a solution to get local nurses better pay without taking away from theirs. Now, there hasn't been a response from the White House on this yet. Of course, we will keep you updated on how all this plays out. Ashley.